Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 62-year-old female presents with joint pain and swelling in her fingers, particularly in the distal interphalangeal joints. On exam, you note y'all, let me just start over. A 62-year-old female presents with joint pain and swelling in her fingers, particularly in the distal interphalangeal joints. On exam, you note the presence of Herbeden's nose on both hands. What is the most likely diagnosis? Because listen, that question was tearing me up, right? But anyway, is it A, rheumatoid arthritis, B, osteoarthritis, C, gout, or D, psoriatic arthritis? Take a moment to tell me what you got in the comments, you guys. All right, all right. So y'all know, I always tell y'all to read the stem of the question first to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most likely diagnosis? You know what I always say, if they're asking you for a diagnosis, you need to run it back and look at the assessment findings, right? So how are they presenting? What is that chief complaint? What is noted on exam? And also, I always tell you to look at those three factors too in the initial description of that HMP, right? Of how old are they? Is this a male or female? What is their ethnicity? These three things can help to build a lot on the diagnosis as well as the treatment, right? So it's a 62-year-old female. Ethnicity is not included. She comes in with complaints of joint pain, swelling in her fingers. It's more particularly noted in that distal interphalangeal joint region, right? So we note that there's Herbeden node on both hands, and we're looking for that most common or most likely diagnosis, I should say. So remembering that Herbeden's nodes in that distal region is more commonly associated with osteoarthritis. So B is your best answer, okay? Question number two. A 70-year-old female presents with complaints of aching and swelling in her fingers. She reports that the joints at the base of her fingers feel tender and enlarged. On exam, you note the presence of bony nodules at the PIP joints, which is the proximal interphalangeal point of the joints, right? So, what is the most likely diagnosis and what type of nodes are these? Is it A, osteoarthritis and Bouchard's nodes at the PIP joints? B, rheumatoid arthritis and Herbeden's nodes at the dip joints. C, gout, tophi at the PIP joints. Or D, lupus erythematous scleroderma at the PIP joints. Take a moment and tell me what you got in the comments. All right, so I always recommend reading the stem of the question first. So, stem of the question here, what is the most likely diagnosis and what type of nodes are these? So, this is a two-part question. So, we want to first determine the diagnosis and then determine the nodes, right? So, 70-year-old female, she's complaining of aches and swelling in her fingers. She's reporting that at the base of her fingers, they feel tender and enlarged. On exam, it's noted that there are bony nodules at the PIP joints, right? So, when we're thinking of dip and pip, so your distal interphalangeal and your proximal interphalangeal, these are commonly associated with osteoarthritis. I know there's some overlap with rheumatoid, but more commonly with osteo. But let's dig a little bit deeper to determine and verify. Now, at the proximal, when we have those bony nodules at the proximal joints, that is Bouchard's node, right? Because remember BP. BP, like blood pressure, BP, Bouchard's, and proximal. Whereas we say HD, like a HD TV, for Herbeden's and distal. So for this to be proximal, it would have to be Bouchard's, and we're already saying for the diagnosis is osteoarthritis. So A would be your best answer. All right, and lastly, question number 3. A 58-year-old man presents with complaints of stiffness and pain in his hands, particularly in the fingers. He reports difficulty gripping objects and notes that his symptoms worsen at the end of the day. On physical exam, you observe hard, bony nodules at the joints closest to the tips of his fingers. What is the most likely diagnosis, and which type of nodes are these? Is it A, gout with the tophi and the dip points? Joints, B, rheumatoid arthritis, and is this a swan neck deformity? C, osteoarthritis with Herbeden's nodes in the dip joints, or D, psoriatic arthritis with edema in the fingers? Take a moment and tell me what you got in the comments, y'all. All right, so the stem of the question here states, what is the most likely diagnosis and which type of nodes are these? So same as like question 2, so let's break this down. So we have the 58-year-old man. He has stiffness, pain in his hands, particularly in his fingers. He has difficulty gripping. On exam, we observe hard, bony nodules at the joints closest to the tips of the fingers. So let's pay attention to what that would be. If it's the joints closest to the tips of the finger, that's distal, right? Remembering that middle joint would be proximal, right? Because remember, proximal is closer to you, right? Where distal is more the distance, proximal is in closer proximity, right? So that's how I think about it. That's the Britney's brilliance in my brain. I think distal is more distant, proximal, close proximity. Okay. But anyway, so this is distal because it is the one that is closest to the fingertips. So when you think of distal and proximal, we think of the location from the more centralized point. So from that, your hand, your body, it's more proximal, and just think of it that way and not in reverse. But the nodules are noted close to the tips of the fingers, so that's more distal, right? So Herbeden's, HD, Herbeden's nodes are distal. And this is, again, back describing osteoarthritis. So C would be your best answer. And then you can rule out also these things. A, we know this is not gout we're talking about, so you can eliminate that. B, even if you're thinking rheumatoid arthritis, there's no mention in the physical exam of a swan neck deformity. Swan neck deformity is when the joints begin to curve like a swan's neck. So it's not that. And then it's not psoriatic arthritis with just edema. So C is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure I'll meet you back here. I'll also put my Herbeden's and Bouchard short video in the description if you struggle with this area, because I like to show that image when I teach, because you can see it better and hear the description. So that might help you if this is a difficult area for you. But if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number 1 at gmail.com. Now, the things that I do offer are all linked in the bio of this channel, including my website. And as always, if you're looking to book any of the one-on-one sessions, I always say either call, text, or email, as I prefer to speak with you so that we can gauge what you truly need to make sure you're booking the appropriate session type. I do receive a lot of questions, so what to expect with our one-on-one sessions. They are all customized, and time and duration is based off of your needs currently. So what we do, you are provided an assessment initially to gauge where you are. It'll be a series of assessment types, and then we'll come up and map out a plan based off of that, so you can determine how you would like to proceed with the amount of time to study based off of the feedback that I provide to you from the assessment. Then we'll move from the planning phase to the teaching phase, where we'll teach and build on those weaknesses noted and those gaps noted in the assessment. And then we will go to our application final stage, where you are applying this knowledge that you have to the questions and making sure that you are exam ready. Okay, so that's how my one-on-one sessions work. So that's why I always say either call, text, or email so that we can gauge where you are and what you truly need. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.